Hello everyone, I am Dr. Sarthak Patnaik. I am an arthroscopic sports surgeon and a specialist in shoulder and joint preservation surgery. Today I am going to discuss about a common pathology which many cricketers or throwers face is basically known as a thrower shoulder. But another variant is the pain is not in the anterior aspect but on the posterior aspect. So that is we come known as the posterior slap tears. So today what we understand is this. I will explain you the shoulder joint, what is a slap tear and what is posterior slap tear. So shoulder joint is basically a ball and a socket joint. So it is covered both sides by capsules. So now if we take a cross section of this part, that is the socket part, it is going to come like this, a round shaped structure. So this is the bone and this is the labrum which surrounds around. So if there is a clockwise, this is 12 o'clock, 6 o'clock, 3 o'clock and 9 o'clock. This is the clockwise motion. So what happened generally in shoulder joint, over here comes is our biceps muscles which go up and up and up and attaches in the under front over here. So this is where the biceps attaches, the anchor of our shoulder joint. So what happened especially in throwers, javelin throwers, cricketers, baseball, all these throwers, they have this common problem which is known as slap. Superior labrum, anterior, posterior tear. So slap is basically is when there is a tear on the anterior aspect. ये है सामने का पार्ट, एंटेरियर या सामने, शोल्डर के सामने, और द पोस्टेरियर पार्ट जब टियर यहां पे होता है, या शोल्डर का पीछे वाला पार्ट. जब यहां पे और यहां पे देयर इज अ टियर, it gets torn over here, this is known as slap tear. So tear in this is slap tear. So today we will discuss about a cricketer who is a bowler. He is a fast bowler and he was complaining of pain on the back side of the shoulder. तो उसको basically यहाँ pain हो रहा था. So it was mostly after doing multiple bowling, multiple overs in the test match or wherever he has gone. He has been bowling for the last 1 to 2 years and the pain was over here. So clinically when I was examining, there was pain and tenderness, यानी छूने से यहाँ पे उसको दर्द होता था. So clinically we did certain tests. We did an apprehension test. ऐसे करने से उसको पीछे पेन हो रहा था, और एक टेस्ट है जब वो ऐसे कर रहा था और उसको पीछे की तरफ से झटका दो तो उसको पीछे की तरफ he was having a pain on the back side. Now, so when a patient complains of pain on the front joint line or on the back side of the joint line, this is when we are suspecting a slap tear. So how do we diagnose more? We need to ask for a MRI. MRI helps us in determining whether there is a slap tear or not. If there is a slap tear, the extent of the slap tear, how big, whether it's superior anterior side or it's the posterior side. So in this patient, there was a slap tear which was posteriorly third. So when he was doing this motion, at this time when he was trying to bowl, he was having a pain over here, or when he was trying to throw the ball, he was having complaining of pain. So whenever this type of patients they come to us, at first we try to treat them conservatively. We put them in certain exercises and medicines. If there is no symptomatic improvement for the next 1 or 3 months, depending upon the demand of the patient, we ask them for a surgical intervention. So we did an arthroscopic procedure in which we found out there was a labral tear on the posterior aspect. We went ahead and fixed it with the help of 2 anchors. Post-op, the patient is doing fine and he is now under observation, and which I'll share slowly. So you saw how we have operated the posterior slab tear with the help of 2 anchors. We should understand the reason why we operated was to fix the labrum back to its normal position, and the fixation technique is very critical, and it has to be done by experts. We treat here all cricketers and throwers patients who comes to us, sports persons who comes to us. We do have a proper clinical diagnosis, investigations, and after proper surgery, we have a proper rehabilitation at our center in Sports Science India. Looking forward, if you need any help, please reach us with the below numbers. Thank you. Jai Hind.